Hey guys, I just wanted to come on here today and talk to you a little bit about fatty liver disease and how it relates to heart health. So, non-alcoholic fatty liver disease affects about 1 in 4 to 1 in 3 people and is characterized by dangerous accumulation of fatty tissue in the liver. Fatty liver disease increases the risk of heart disease and is correlated as well with diabetes and obesity. So the main cause of death in people with non-alcoholic fatty liver disease is cardiovascular disease or heart disease. There is also an increased risk of non-fatal cardiovascular events in people with non-alcoholic fatty liver disease. So probable contributing factors include, among others, obesity, oxidative stress, inflammation, insulin resistance, hypertension, and an imbalance between the different types of good and bad bacteria in the gut. So, how do you know if you have fatty liver disease? Well, typically there are no symptoms, but some people do experience fatigue, feeling tired, feeling unwell overall, or pain in the upper right abdomen when you have fatty liver disease. Your doctor can test for fatty liver disease in 2 steps. Usually there would first be a blood test where your doctor will look for elevated liver enzymes. And secondly, your doctor will scan your liver with an ultrasound, a CT scan, or an MRI to be able to visualize the appearance of the liver. And your doctor will look for fatty tissue in the liver and scarring, which is called fibrosis. So there are risk factors for fatty liver disease, including obesity, especially in the abdominal or visceral region of the body, high cholesterol or triglycerides in the blood, polycystic ovarian syndrome, insulin resistance and metabolic syndrome, type 2 diabetes, and sleep apnea. So what can we do? Well, fortunately, when it comes to our liver health, dietary and lifestyle changes can make a big difference. Intervention through nutrition and exercise should focus on reducing inflammation, oxidative stress, and extra body fat, reducing blood lipids, especially triglycerides, and controlling blood sugars. So some nutrition strategies to try could be increasing fiber intake, replacing unhealthy fats with monounsaturated and omega-3 heart-healthy fats, limiting simple carbohydrates and sugars, eliminating alcohol, ensuring you're drinking enough water, enough fluids for hydration, and optimizing your antioxidant intake. Well, what about supplements? There are all sorts of supplements out there, but honestly, food comes first. When it comes to your health, your liver health, your heart health, ideally optimize your nutrition first. Then you could consider adding some supplements. There are some possible supplements to include that are purported to be beneficial for for liver health, and those include SAMe, which is S-adenosylmethionine, milk thistle, NAC, which is N-acetylcysteine, TUDCA, which is, I always have to look at this one because I can never remember how to say it, tauroursodeoxycholic acid. Coffee might be beneficial, spirulina, and picrohiza kuroa as well. So a whole bunch of funny words that may be beneficial, some of them more than others, for your liver health. So whether or not you should take these supplements is individualized. And if not addressed, fatty liver disease can progress to more serious liver disease and other health problems like heart disease. So you can learn more about addressing fatty liver disease and reducing your modifiable risk factors for heart disease by working with me. I'm taking on just 2 clients to work with me one-on-one in my program to reduce fatty liver disease and improve heart health. So if you are interested in learning about whether we would be a good fit to work together, click the link and book your free discovery or empowerment call today to start reducing your risk of heart attack and stroke and liver disease. We'll talk again soon. Have a good one.